Hey everybody, I'm here with Dr. Justin Johnson at Re Medical in Salt Lake City. You can find them at remedical.com. So we're here to talk about their treatments for ED and some of the other treatments available there and the success they've been having with those. So Dr. Johnson, thanks so much for joining us today. I really appreciate it.
Yeah, it's great to be here.
Yeah, I really appreciate it. And I wanted to start off just by asking how long you had been working in the space with, men's health and with ED specifically.
So our clinic's been open about 2 years, but I've actually been doing research on the devices for several years before that. And I helped to develop some laser technology in the women's space, which kind of led me into the men's space because they kind of go hand in hand. So we've been using these devices and for quite some time. In fact, we have a few devices. We're the only ones in the world who have, because we're doing research on them. They're specifically designed in that they deliver more energy than other devices, which is important in ED because ED is due to plaque buildup in the arteries and also loss of blood vessels from this plaque buildup. So if you can get more energy to deliver to the arteries to break up the plaque, then the body can clear the plaque better and you can get the signal through. And then you can also grow new blood vessels better because you get a stronger signal for blood vessel growth.
Yeah, it definitely makes sense. And so is it just seeing, the need in that space and how many men were suffering with ED that got you, interested in starting to work with that?
Yeah, I've always been really interested in health, men's health. I'm a facial plastic surgeon by training. And so, I'm used to using lasers. I used lasers for incisions and whatnot and did research on them. And so, being a man myself and starting to suffer from the effects of ED, I thought, what better way than to do some research and see what you can get, to help men. So we've really before the low intensive shockwave therapy came about, there really wasn't any great treatments for it. None of them really treated the root causes of ED. So, mostly people were using medicine or like penile implants or something along those lines. So this is a great non-invasive way to treat ED. And what it actually does is it reverses time. So remember, ED, like I said, is a disease. It's the same disease process as heart disease, where you get plaque buildup in your arteries, you get loss of blood vessels. So what the low intensity shockwave therapy does is we, shoot a sound wave at a certain frequency. That frequency is toned or honed to the frequency that breaks up plaques the best. And so then you shatter the plaques into smaller plaques, and then the white blood cells will clear them. What's interesting is people don't realize that you start depositing plaques in your arteries the minute you have a heartbeat. It's just that your body's able to clear the plaques when you're younger. But about age 25, with hormone changes and whatnot, the plaques get a little bit too thick and greasy and they don't get cleared as well. So they start accumulating in the arteries. And that's when you start getting the process of ED going, and then you get plaque buildup and you lose the signal, so you can't get as good an erection. Plus, you lose blood vessels, which is important for an erection because that's what's filling the penis is the blood.
Sure. Yeah, that makes sense. And so is there a good way for men to know if they would respond well to shockwave therapy?
Yeah, so shockwave therapy is very successful. It runs about in the studies about a 95% success rate. We're closer to probably 97, 98%. Now, with medicine, nothing's ever 100%, but it's pretty successful. Each person gets a little bit different outcome depending on the severity. So if you have very severe disease, it's going to take more than, say, one treatment protocol. If you have light disease, then usually you can get great results with this one treatment protocol. Plus, there's more things than just the low intensity shockwave therapy. There's some additional therapies that you can use that will help with the treatment outcomes. So, for example, PRP, platelet-rich plasma injections, are very helpful in terms of treating ED. The reason is when you create a signal to grow the blood vessels, the body still has to grow the blood vessels. It requires material to grow the blood vessels. The material happens to be in the blood, so the growth factors and the material to make new blood vessels are in the blood. And that has to leak out into the surrounding tissue so you can grow new blood vessels. So what PRP does is we're actually taking that stuff out of the blood, the material you need to grow new blood vessels and the growth factors, we're concentrating it down into a nice, really concentrated solution, which we put back into the area, which helps with blood vessel growth. So the way I look at it, it's like building a house. With the low intense shockwave therapy, we can create a really nice foundation for the house. But unless you buy the wood to make the walls, the house doesn't get built. So that's where the PRP therapy comes into. It's essentially like purchasing the material to build your new blood vessels.
Yeah, it definitely makes sense. It almost sounds like it's similar to, if you were to work out, you're breaking down the muscle, but you also need the nutrients and the recovery and everything to be able to build back better.
Exactly. It's the exact same principle. You can break down your muscle, but if you don't get the protein and the building blocks to build the new muscle, then the muscle doesn't get built because there's no material to build it. Exact same thing with the ED.
Yeah, yeah, it definitely makes sense. And for most guys, if they're, a little concerned about maybe the name of shockwave therapy, is there any side effects or is there any pain associated with it?
Yeah, it's a painless process. There's no pain. The reason they call it shockwave therapy is what you're essentially doing is you're creating a wave which shocks or creates a signal in the blood vessel. So it's not really like electrical shock. It's not nothing like that. It's essentially just a wave that creates what are called they're called cavitation vacuoles, which is a fancy name for bubbles that dissolve on themselves. So you create all these little bubbles, and when they dissolve, they kind of shock the blood vessels, which causes them to create a signal, which is called vascular endothelial growth factor. And this signal is a signal to say, hey, we need to make new blood vessels. Does that make sense? So it's painless. There's really no downside to it. I mean, I have not seen really any like problems with the treatment. I mean, occasionally someone might get a bruise, but we actually haven't seen it.
Oh, good to hear. And is there, a typical amount of sessions that you usually recommend for patients to do with that, or does it just depend on the severity?
Well, usually, so there's been fair amount of studies done in the last 10 years, over 50 studies, and what they've looked at is how many sessions you need. The general consensus is that you need around 6 sessions. Now, you can do it one of three ways. You can do one session a month for 6 months, one session a week for 6 weeks, or 2 sessions a week for 3 weeks, which is what we usually do. The reason is you get this thing called signal amplification. So if you do 2 treatments a week for 3 weeks, then you get more signal to grow new blood vessels. But our treatment protocol actually lasts longer than the 3 treatments because we actually do some things in between to help grow the blood vessels. Because the process to grow blood vessels takes roughly 8 to 10 weeks. We know this from studies with diabetics and diabetic retinopathy back before ophthalmologists had treatments to treat diabetic retinopathy. All they could do is look in the person's eyes and say, oh my gosh, they're growing blood vessels. And then they'd watch them grow blood vessels, which took 8 to 10 weeks. So that's how we know how long it takes. But you get a stronger signal if you do 2 treatments a week for 3 weeks than if you do one treatment a week for 6 weeks in the other treatments.
Yeah, it makes sense. And so if, a patient gets relief from those treatments and then let's say, a year or two down the line, they start having some issues again, can they come back in and get, some maintenance treatments?
Definitely. So, what's going on, interesting enough, the low intensity shockwave therapy is essentially reversing time. So, what you're doing, like I said, is you're breaking up the plaques. So, the body's reabsorbing the plaques. So, it's going back to when you had less plaques in there, and you're growing new blood vessels, replacing the ones you've lost. The
Mhm.
interesting thing about the blood vessels you replace is they don't actually have plaques in them because that takes a while to develop. So, you get a good amount of time between treatment sessions. Now, remember, it's not really curative because it's an aging process, so we haven't stopped aging. If we do stop aging, I'll tell you, you can come see us and we can all de-age, but that hasn't happened yet. So, the results last quite a while, but they're not permanent because you're not stopping the aging process. But you definitely can come back in, and then you don't have to do a full treatment series. Usually a couple, touch-up treatments will do the trick. Yeah, usually we recommend maybe 5, 6 years out is when most people will need it.
Okay, yeah, 5 or 6 years is a really good amount of time that they can find relief. Is there,
Yeah, and it depends too on their age. What's interesting is younger men who have ED at a younger age will probably need more touch-up treatments just because they're younger and they've developed ED quicker. We tend to find men who don't start to get ED till like 60 don't need as much touch-up because their hormones have changed and they're not depositing the plaques as much. Does that make sense? It's really dependent upon how many plaques you develop and how many blood vessels you lose. So if you start to get ED symptoms later in life, it just means you're not putting as many plaques in your arteries, not losing many blood vessels. So that process, remains the same for that person.
yeah, definitely. And is there a benefit to coming in as soon as they start seeing a decline in function?
Definitely. In fact, we tell people, people get the wrong impression that ED is complete loss of function. When in reality, it's any loss of function, not complete loss, but you start having any symptoms. So it is, and in fact, it can be preventative. So if you came in before you have symptoms, then you'll delay having symptoms. That's the nice thing about it because like I said, when you start reaching about 25, you start building the plaques up. So if you're 30, you come in and get a couple of treatments done, then now just delay you getting ED. And so you can actually prevent getting ED by these treatments. So the sooner you start having symptoms, the better, because it's much easier to break up a small amount of plaques than a large amount of plaques.
Yeah, it definitely makes sense. And do you, typically recommend any, lifestyle changes or anything like that? How can, guys make the most out of getting these treatments?
Well, definitely. So ED, like I said, is basically heart disease in the genital area. So any type of lifestyle changes you do for heart disease, the same thing will occur with ED. So diet, you want to do like the Mediterranean diet's an excellent diet where you eat a lot of leafy green vegetables and olive oil and those kind of things, and fish, and not a ton of red meat. Lose weight, obviously. So high fatty diets are bad. Exercise is helpful. If you exercise, you can definitely delay the onset or help improve ED, those type of things.
Yeah, it's good to hear. And yeah, I think spreading education about these treatments can really help because for a lot of guys, I think if they're experiencing ED, they might just be at their primary care doc and maybe just mention it on the way out the door. So we want them to be able to feel like they have something that's a little bit better treatment than that if the medication's not working for them.
Yeah, exactly. And so what happens, interesting enough, is ED is so prevalent. People don't realize how prevalent ED is. So if you look at the studies, 50% of men over 50 suffer from ED. And those are self-reported cases. So it's probably closer to 60%. By 70 years old, it's nearly 100% of men suffer from ED. But even at 30, it's almost 25 to 30% of men suffer from ED at 30 years old. And it's been increasing because of the prevalence of the American diet, fatty diseases and whatnot. Same thing with heart disease. Again, ED is heart disease in the genital area. So it makes sense that as heart disease progresses, so does ED. But it doesn't have to be that way. You can reverse it. In fact, these machines would be an extraordinary breakthrough for heart disease treatment if you could get it past the chest wall. The problem is the chest wall, the bone blocks the signal, so you can't treat the heart disease. But if you could, it would be revolutionary. Unfortunately for us, the penile area and the blood vessels do not have any bones blocking it, so we can get the signal through and get great results.
Yeah, that's great to hear. And what would be the best way for patients to get in contact with you if they're in Salt Lake City? Or I understand you guys are opening up some new locations as well.
Yep, we're in the process of opening up some locations in Arizona as well as Orange County, San Diego, and LA, and then we're going to expand from there. So you can go to our website, which is remedical.com, which is remedical.com. The reason we named it remedical is we're research and evidence based. So we track all of our protocols, we track all of our results, and we tailor them to get better results. So I can say confidently the treatments we do today are different than the treatments we did a year ago, simply because we tracked all of our results, talked to people, and we make changes to make it even more effective. So we're really getting great results. So just really quickly, so people know, the way people assess erectile dysfunction is this thing called the International Index of Erectile Function 5, for the fifth iteration, but it's a questionnaire that's been in use for 40 years. And it goes on a scale from 0 to 25, meaning 0 is no function and 25 is complete function. So most men are somewhere in that range, in between there. When we see most men, it's when they start to have mild to moderate dysfunction, which is around 16, 17, 15, somewhere in that range. The reason is when you start getting mild dysfunction, you can, so to speak, power through it. But you get to a point where it's more difficult. So then people come and see us. But even if you're on the 0 to 1, 2, 3, 4 scale, we can definitely help you out, because it just means you might need more treatments, but we can definitely improve or get you back to normal. The mild people almost always get back to normal, almost 100% of the time. And like I said, it's preventative. So if any mild dysfunction, come in and see us, because we can prevent it from actually happening.
Yeah, definitely. That's great to hear. Yeah, I think for a lot of guys, they might think that, there's something wrong with them or that, there's some shame in going and getting help for this. But obviously, like you're saying, there's so many men that suffer from it. And it's one of those things where there are treatments out there for that. So they should definitely reach out and just see if there's something you guys can do to help them.
Definitely, and if you look at the studies, because we do a lot of studies, research, and keep track of the research, the incidence of ED and like low sperm count and sexual dysfunction has increased significantly over the last 50 years. So back in the 70s, there wasn't as much prevalence of ED as there is today, as well as low sperm count, those problems with testosterone levels, which probably has something to do with the diet and like the different chemicals that are in the environment these days. They all affect that. So it's been decreased, but you don't have to suffer from these things. That's what's crazy is I know people who go through suffer, then they find us, and you should see how happy we really restore great sexual relations with their partners. I mean, men are so happy ever to come see us. The intimacy we've restored. Because what people don't realize is there's been tons of studies done on the importance of a good sexual wellness, good sexual, intimacy. Meaning those who have a good sexual life, for example, have much less incidence of heart disease, much less incidence of depression, much less incidence of strokes, much better income levels, all sorts of things that go along with it. So it's an important part of life. And so it shouldn't be neglected. I know people are hesitant to discuss it, but in today's age, it's a medical condition. It's not like, some like thing we should hide under the covers. It's a medical condition that can be treated with medical treatments, with energy-based devices, with injections, various things, and we can get great results. You don't have to suffer from it.
Yeah, definitely. That's a great way to put it, that it is a medical condition. And I think for, anybody that's listening that, either for themselves or if they have, a partner that's suffering from it, then it's definitely worth, sharing the education about and seeing if there's something that can be done to help.
Exactly. Exactly. So it's such we like I said, we see such great results. And the thing that's so rewarding is just to see how happy people are after. Because, one of the things we do is we do the treatments, but we follow up. We're very diligent in following with everyone to make sure they're getting good results, tracking the thing, making adjustments. So we track everything and make sure we're getting good results and adjust our results accordingly. So it's just so, wonderful. And we're just so happy to see such, happiness from the men we treat.
Yeah, definitely. That's good to hear. All right, awesome. Yeah, well, those are the questions that I had for you. Was there any last advice or anything you wanted to leave the patients with if they're struggling with ED and just not sure what to do?
Yeah, so you people often ask, and obviously I'm trying to plug my clinic, but even if you don't come to us, what you want to do is you want to go to someone who's reputable, because there's a lot of like flyby clinics, that they buy a energy-based device, they watch a video for 2 hours and they start treating people.
Mhm.
You want to go to someone like us who've actually done the research, put the time in to develop the machines ourselves. We're all trained. Everyone in my office has advanced degrees. We're either a nurse practitioner, myself, a physician. We have a couple of physicians. Even the people who give the treatment are master estheticians, which is a 20,000 hour, or 2,000 hour thing where they have to go for 9 months just to learn how to use energy-based devices. So we're all well trained. We do the research and we all offer multiple treatment options. Because here's what happens: a lot of places will just offer the low intensive shockwave therapy, which is great, but it's like I said, heart disease. You start having heart pain, you don't go to the doctor and just say, "Hey, I want to bypass surgery right now." They give you medicine, or they might do a stent, or they might do something else before they jump into the major thing. So sometimes you don't even need the low intensive shockwave therapy. Sometimes you might need counseling or whatnot. But our goal is to get people off the pills, get them back to functioning normally, and get back to spontaneous intimacy.
Yeah, that's great to hear. All right, awesome. Yeah, well, I love the work you guys are doing there, and I really appreciate you taking the time to talk with us today and share the education on that.
Yeah, and it's great. And if anyone wants to call us, definitely give us a call. The easiest way to get hold of us, like I said, is go to our website, which is remedical.com. Or you could call us at our number is pretty easy to remember. It's 4343 restore, because we're trying to restore people's function. So 4343 restore, come call us. We're happy to answer your questions and help you out. Definitely.
All right, awesome. Yeah, definitely. Well, thanks again for taking the time to talk with us today. I appreciate that.
Yeah, my pleasure. Anytime. Thank you so much for having me, Cal.
Yeah, no problem.